Okay, Randy, we're just getting started on your right shoulder. We're looking at it from the back to the front. Everything that we see is magnified 30 or 40 times on the screen. And here we're looking at your biceps tendon. As we look at the top of the screen, we can see that your biceps, as it exits the shoulder, looks fine. Right there. As we look down at this insertion, we can see how this tearing appears in the biceps. So, first of all, there's not a lot of labrum in this part right here at the tip of the cannula. But as we hold the biceps back, you can see how you've had this area kind of peel off. So I'm concerned that that tear goes a little bit too much into the biceps, so we're going to do a different type of biceps tenodesis. We're not preparing it right back to the labrum here, so I'm worried that that tear would limit our success rate here. So we're going to go ahead and take a spinal needle and a relay, and we'll show you how we're going to do this here. We're going to pass the needle right through the biceps tendon. Okay, so there's our first pass, and then we'll take our spinal needle, and in just a minute we'll take a grasper. Okay, grasper. And then next we'll take a special kind of suture. It's real strong. There's our grasper. So outside your shoulder, we're going to load that. Pause, please. Okay, so here we are looking down the front of the shoulder, and while we're waiting to get a suture, I just want to show you the anatomy down the front. So here we are looking down the front. There's a little bit of fraying in the labrum, pretty easily addressed with our shaver, as you see here. But the rest of the anatomy is checking out just fine. And then as we look towards the back of the shoulder, labrum looks good, this posterior capsule looks good, and then the rotator cuff looks just perfect. So now we're going to go ahead and, hold the camera please, load this with the number 2 hi-fi suture. Pull back, and you'll see how that suture gets pulled through. Now we'll take our spinal needle again. See if we can get there. There we are, coming through there. And now we'll pass that relay through again. We're going to reach around and grab the relay on the other side of the biceps. Good loop going around the biceps there. We'll take a pair of arthroscopic scissors and we'll cut the biceps at the base, right down here. Okay, so here you can see what happens as we pull tight on the biceps. We have it anchored down. And now we've released it down at the tip of this cannula, and that looks good, so that won't cause any more problems there. We'll go off on the video and get to work in the subacromial space next, possibly. Okay, Brandon, so now we're up above the rotator cuff in a part of the shoulder called the subacromial space. and we are taking off a little bit of the anterior acromion, which is this bone hanging down right here. We're just going to start the burr and remove that. Okay. And now we'll get over here and look at the clavicle. Now we're going to switch the burr to the front of the shoulder. Okay, we're just finishing up our work on the clavicle, which is at the top of the screen is where our burr is right now. Okay, so here's the clavicle on the right, the acromion's on the left. You've got at least 6-7 millimeters between the two now. Usually enough space for the decompression. Okay, good. So we're going to finish up there. Next, we're going to get those. We're going to get the sutures and take care of that biceps tendon in just a minute. Pause, please. Finishing up here, you can see, or in just a minute, we'll be able to show you all the work we've done. So here's the work on the bone at the top of the screen. That's the AC joint over there. That cut edge that's facing us is the clavicle. That all looks good. We're going to release this a little bit more because you were having some significant impingement symptoms. Just want to make sure this is open for you and it looks good now. Okay, and then the biceps that we had to tie, there's the suture for the biceps tenodesis below. So we're going to finish up here and get you back to the recovery room shortly. The rotator cuff looks great on this side too, so there's no problem with the rotator cuff. So hopefully this will do the trick for you, okay? Good luck to you now. Bye-bye.